A drug epidemic that's sweeping the nation and affecting the lives of thousands of people right here in Kern County. 23 ABC's Kelly Johnson has been investigating the rise of this drug and its use here in our community. Kelly?
Tim, according to the Center for Disease Control, heroin use increased nationwide amongst both men and women, most age groups and all income levels. We want to warn you that some drug images and references in the story may be disturbing to some viewers.
I was young. I was definitely young.
Johnny Bourne remembers the time he hit rock bottom.
I was up in San Francisco. I died on the streets there from an overdose, a heroin overdose.
Bourne had his first cigarette before his 10th birthday, and by age 15 he was smoking pot and living life on the streets.
I became a professional criminal.
Within the next year, his father died. That loss led him to his first dose of heroin.
The guy I was working for slid over a syringe full of heroin and said, "This will stop it. This will stop that pain you're feeling."
For over a decade, his heroin addiction controlled his life.
It was such a euphoric feeling. It was such a good feeling that it gave me that I wanted more.
Now he's just days away from graduating from the recovery program at the Mission at Kern County. One of his mentors says he's come a long way.
His story is incredible.
Although Bourne was introduced to heroin on the streets, some are being introduced differently.
This is OxyContin, very popular opioid pain medication.
Kern County Sheriff Donnie Youngblood says his deputies are seeing a resurgence of heroin use.
Oxycodone becomes very expensive and heroin's very cheap in comparison.
Adrian Buckle with Kern County Mental Health says one challenge unique to Kern County is its location and sparse population.
There's a lot of opportunity for people to bring drugs into our community and to pass through our community with drugs.
Heroin is an opioid, and now users are finding other ways to get heroin into their bodies.
It used to be just kind of more injectables back in the day, and now they tend to snort them and crush them.
The CDC reports nearly half of people who use heroin were also addicted to prescription opioid painkillers.
If you look at the chemical nature of both those drugs, you'll see that heroin's closely matched to it.
Taking pain pills doesn't always lead to an addiction.
That's not really necessarily the case.
However, pharmacies have updated protocol to better detect those with drug-seeking behavior.
It's our duty to stop you from filling that medication because we can suspect that you might be abusing it or that it could lead to an overdose or death.
Kern County Mental Health reports that last year they saw 456 patients seeking treatment for a heroin addiction. That's up from the 27 who sought treatment back in 2009.
Maybe 13. I started drinking.
Buckles says addicts commonly start drinking at a young age.
99% of them say, "I started using alcohol when I was in middle school."
The reversal agent called Narcan can treat a narcotic overdose, but it doesn't always work. It's often administered by paramedics, and once they make it to the emergency department, Dr. Jeffrey Kanye says doctors can easily identify a heroin user.
They are non-responsive to stimuli, they're really not responding to anybody around them, and then they have the pinpoint pupils.
The recovery program at the Mission at Kern County is a year-long and is faith-based.
Today, as you are on the verge of battle with your enemies.
Bourne has managed to stay clean and says gaining faith has been essential in keeping his willpower.
I don't consider myself to be an addict anymore.
Carlos Baldovinos is the executive director at the Mission at Kern County. He hopes Bourne will stay on track and won't relapse like some have in the past.
To us, when we've seen that from time to time, it's very heartbreaking.
Bourne believes he's done with substance abuse for good.
I truly believe that I'm done. I would say cured.
After graduating from the recovery program, he'll move into transitional housing and will become employed.
I really believe sky's the limit for him.
A promising new beginning after years in the dark.
It turned out good. It definitely turned out good.
Bourne graduates from the recovery program on Friday. Also, the government has become more involved in opioid regulations. New pharmacy laws with stricter guidelines will go into effect in January. Live in studio, Kelly Johnson, 23 ABC.